Performing a proper neurologic P is essential, and here are the key steps in performing a thorough exam.
As the patient enters the room, start observing her general behavior and appearance. This includes the level of consciousness, posture and motor behavior, dress, grooming, personal hygiene, facial expressions, manner, and affect. Once the patient is settled down, you can now ask questions to evaluate her cognitive ability. You can start with testing the patient's orientation by asking her name, the day-to-day, and the place where the interview takes place. This can be followed by testing the patient's memory. Questions regarding recent memories such as the day's weather or the maintenance medications she took this morning, and remote memories such as birthdays or names of schools attended. You can also ask for the patient's mood today, including her usual mood level and fluctuations related to life events. As you converse, observe the patient's speech and language, its quantity, rate, and volume. Throughout the interview, you can also assess the logic, relevance, organization, and coherence of the patient's thought process as well as her thought content. Other parts of the mental status exam, like attention, would require tests such as your serial sevens or spelling a word forwards and backwards.
Start by assessing the sense of smell using non-irritating substances such as coffee or mint. Ask the patient to compress one side of the nose and identify the odor through the other. Then, move on to the assessment of visual acuity using a Snellen chart, visual fields, and pupillary responses using a pen light to examine the pupil size and reaction to light. Check extraocular movements by asking the patient to follow your finger or pen light as you move it through the 6 cardinal directions of gaze. Assess facial sensation by using a cotton swab to lightly touch different areas of the face, including the forehead, cheeks, and chin. Ask the patient to clench their teeth and palpate the masseter and temporalis muscles for strength and symmetry.
Continuing with the cranial nerve 7 examination, first we inspect the face both at rest and during conversation. We then ask the patient to raise both eyebrows, frown, close both eyes slightly, and we test her muscular strength by trying to open them. Show both upper and lower teeth, smile, and then puff out both cheeks. For cranial nerve 8, first we perform the whispered hearing test. Place one hand on one ear and whisper a word or number and then ask the patient to repeat it. Repeat these to the other side. Next, we test for air and bone conduction using the Renae's test in each ear by placing a tuning fork against the masted bone and then in front of the ear. We assess lateralization using the Weber's test by placing the tuning fork on the middle of the forehead. We start testing cranial nerves 9 and 10 by assessing the patient's voice. Is it hoarse or of a nasal quality? Then ask the patient to open their mouth and say ah. Here, we ask the patient to swallow. This can also show that the patient has intact gag reflex. For the cranial nerve 11, from behind, we look for any fasciculations or atrophy. Ask the patient to shrug both shoulders against your hands, and then ask the patient to turn his or her head to each side against your hand. Repeat this to the other side. Lastly, for the assessment of cranial nerve 12, listen to the articulations of the patient's words, inspect the tongue, and ask to protrude it. Then ask the patient to move their tongue from one side to the other, looking for any asymmetry, atrophy, or any deviation from the midline.
In assessing the motor system, check first on the body position, involuntary movements, characteristics of muscles, and grading for muscle strength. These are the techniques for examination. For upper extremity, first testing for deltoids, pronator test, arm flexion, arm extension, wrist extension, grip, and thumb opposition. For lower extremity, hip flexion or extension, and knee extension or flexion.
First, inform the patient about the test. The gait of the person can be observed while the patient walks. Then ask the patient to touch their nose and your index finger with their index finger, alternating each hand, then observe. Ask the patient to close her eyes with feet together, then observe for any signs.
In heel-to-toe exam, ask the patient to stand up and walk in a straight line, placing one foot directly in front of the other. In heel-to-shin exam, ask the patient to lie down and trace the heel of their foot on the shin of the other, foot to knee, and repeat with the other leg.
Light touch. Use a cotton swab to lightly touch the skin in various areas of the body and ask the patient if they can identify the said touch. Pain sensation. Use a pin or dull object to lightly prick the skin in different areas and ask the patient to report if it feels sharp or dull. Test vibration sensation by using a tuning fork and placing it over bony prominences such as the fingers or toes. Ask the patient to report whether they feel the vibration or not. Test proprioception by moving the patient's fingers up or down. Ask the patient to report the direction of the movement.
Hold the reflex hammer loosely between your thumb and index fingers so that it swings freely. With the patient in sitting position, check for the deep tendon reflexes by tapping briskly on the tendon. Biceps reflex. Triceps reflex. Brachioradialis reflex. Patellar reflex. Achilles reflex. For the plantar reflex, stroke the plantar surface of the foot from the heel laterally, then medially across the metatarsal pads.
The following are important indicators for meningeal irritation: the Kernig sign and the Brudzinski sign.
By following these steps, you can perform a thorough neurologic PE to help diagnose and treat neurological conditions. Findings can be recorded in two ways. Here are examples of reporting normal and pathologic findings in either format. If not performed, not tested may be written.